This is lesson number 2 of blood-borne pathogens, preventing disease transmission. So first, let's discuss what is a blood-borne pathogen. A blood-borne pathogen is infectious microorganisms that are present in human blood and other potentially infectious materials and can cause disease in humans. Being aware of disease-causing agents, how they are spread, and their signs and symptoms will help you prevent exposure to those illnesses and recognize them. Okay, let's look at this scenario here. Your police unit responds to a call for a medical emergency involving a man who has collapsed in front of a school building. When you and your partner arrive, you see that the man is bleeding from the mouth and face. Vomit and blood are on the ground around him. His face hit the ground when he fell. A bystander says the man does not appear to be breathing. Okay, this is one of the discussions that we are going to have in person. So just take a look at this and think about how you will handle this situation. Okay, so on the next slide here, we have pathogens, okay? So let's discuss some of the most common pathogens. Okay, first we have germs, okay? We have different germs. That's a form of, those are the most common pathogen. We have bacteria. A few examples of bacteria will be meningitis, scarlet fever, strep throat, tuberculosis, gonorrhea, syphilis, chlamydia, Lyme disease, food poisoning, anthrax. Those are some examples of bacteria. So now we have viruses. Let's give an example of a few viruses. So you'll have hepatitis, measles, mumps, chickenpox, meningitis, influenza, the flu, warts, colds, herpes, HIV, which causes AIDS, genital warts, smallpox, Ebola, and those are a few examples of viruses. Okay, so now we'll look at a few other pathogens. Maybe some pathogens that we don't encounter as often. So here we have fungi. So that'll be athlete's foot, ringworm, and things like that, okay? And then we have protozoa. We have malaria, dysentery. Those are a few. Parasitic worms, okay? We'll have abdominal pain, anemia, lowered antibody response, respiratory and circulatory complications. Now we'll look at prions here. We'll have CDJ, or mad cow disease, for example. And we'll have yeast, candidiasis, also known as thrush. Okay, let's go on our next slide here. And we're going to look at the body's natural defenses. The body has a series of natural defenses that prevent infectious microorganisms from entering. The body depends on intact skin and mucous membranes in the mouth, nose, and eyes to keep infectious microorganisms out. When the skin is damaged, infectious microorganisms can enter through openings, such as cuts or sores. Mucous membranes in the mouth, nose, and eyes also work to protect the body from intruding infectious microorganisms, often by trapping them and forcing them out through a cough or sneeze. However, mucous membranes are less effective than skin at keeping blood-borne pathogens out of the body. If these barriers fail and a germ enters the body's immune system begins working to fight the disease. The immune system's basic tools are antibodies, while the white blood cells. Special white blood cells travel around the body and identify invading pathogens. Once they detect the pathogen, white blood cells gather around it and release antibodies that fight infection. These antibodies attack the pathogens and weaken or destroy them. Antibodies usually can rid the body of pathogens. However, once inside the body, some pathogens can thrive and, under ideal conditions, multiply and overwhelm the immune system. This combination of preventing pathogens from entering the body and destroying them once they enter is necessary for good health, called homeostasis. Sometimes, however, the body cannot fight off infection. When this occurs, an invading pathogen can become established in the body, causing infection, which may range from mild to serious and brief, acute to long-lasting chronic. Fever and exhaustion are often a sign and symptom that the body is fighting off an infection. Other common signs and symptoms include headache, nausea, and vomiting. There are different types of human immunity: innate, adaptive, and passive. Innate immunity. We're going to talk about innate immunity. Is the type of protection with which we are born. The term innate immunity also refers to the natural barriers our bodies have. The term innate immunity also refers to the natural barriers our bodies have, such as the skin and mucous membranes in the nose, throat, and gastrointestinal tract that prevent most diseases from entering our bodies. All right, now we're going to discuss adaptive immunity. Develops throughout our lives as we are exposed to diseases or are immunized against them. Passive immunity is immunity we gain from external sources, such as from a mother's breast milk to an infant. Exposure to blood and OPIM occurs across the variety of occupations. Healthcare workers, emergency response personnel, public safety personnel, and other workers can be exposed to blood and OPIM through injuries from needles and other sharp devices, as well as direct and indirect contact with skin and mucous membranes. The four conditions necessary for spreading disease. For any disease to spread, including bloodborne diseases, all four of the following conditions must be met. A pathogen must be present. That's number one. Number two is a sufficient quantity of the pathogen to cause disease must be present. Number three, a person must be susceptible to the pathogen. Not everyone is capable of getting the same thing. Some people have immunity to certain things and some people don't. The pathogen must pass through the correct entry site. For example, eyes, mouth, and other mucous membranes or skin pierced or broken by needle sticks, bites, cuts, abrasions, and other means. Okay, now let's talk about direct contact. Okay, how are they spread through direct contact? How are pathogens spread? Direct contact transmission occurs when infected blood or OPIM from one person enters another person's body at a correct entry site. For example, direct contact transmission can occur through infected blood splashing in the eye or from directly touching the OPIM of an infected person. The infected blood or OPIM then enters the body through a correct entry site. Now we're going to talk about indirect contact. Some bloodborne pathogens are also transmitted by direct contact. Indirect contact transmission can occur when a person touches an object that contains the blood or OPIM of an infected person, and that infected blood or OPIM enters the blood through a correct entry site. These objects include spoiled dressings or equipment and work surfaces contaminated with an infected person's blood or OPIM. For example, indirect contact can occur when a person picks up blood-soaked bandages with a bare hand and the pathogens enter through a break in the skin on the hand. Okay, let's discuss respiratory droplet transmission. Other pathogens, such as the flu virus, can enter the body through droplet transmission. This occurs when a person inhales droplets propelled from an infected person's cough or sneeze within a few feet. A person can also become infected by touching a surface recently contaminated by infected droplets and then touching the eyes, mouth, or nose with contaminated hands. Okay, so vector-borne transmission. Vector-borne transmission of diseases such as malaria, rabies, and West Nile virus occurs when an infectious source such as an animal or insect bite or a sting, penetrates the body's skin. Let's go to the next slide here. All right. Okay, these are diseases that really cause concern. bloodborne diseases that are more serious here. We have hepatitis A, B, C, D, and E. Hepatitis is a type of liver disease. Hepatitis A is caused by the hepatitis A virus HAV. This disease is spread primarily through food or water that has been contaminated by stool from an infected person. HAV is transmissible by eating food prepared by someone with HAV who did not wash hands after using the bathroom, engaging in certain sexual activities such as oral, anal contact with someone who has a HAV, changing a diaper and then not washing hands, drinking water that has been contaminated. HAV causes inflammation and swelling of the liver. The patient may feel ill with flu-like symptoms or may experience no symptoms at all. Symptoms of HAV usually disappear after several weeks. This disease rarely causes permanent damage or chronic illness. HAV can be prevented with the hepatitis A vaccine, which is a series of 2 injections administered at least 6 months apart. The most effective prevention, though, is healthy habits. Always wash your hands thoroughly before preparing food, after using the toilet, and after changing a diaper. International travelers should be careful about drinking tap water. Now let's discuss hepatitis B. Hepatitis B is a liver infection caused by HBV. Hepatitis B may be severe or even fatal, and it can be in the body for up to 6 months before symptoms appear. These may include flu-like symptoms such as fever, fatigue, abdominal pain, loss of appetite, nausea, vomiting, and joint pain, as well as dark urine and clay-colored bowel movements. Later stage symptoms include jaundice, which causes a yellow of the skin and eyes. Medications are available to treat chronic hepatitis B infection, but they do not work for everyone. The most effective means of prevention is the hepatitis B vaccine. This vaccine, given in a series of 3 doses, provides immunity to the disease. Scientific data show that hepatitis B vaccines are safe for adults, children, and infants. There is no confirmed evidence indicating that the hepatitis B vaccine causes chronic illness. The hepatitis B vaccine series must be made available to all employees who have occupational exposure, usually within 10 working days of initial assignment. After completing appropriate training, however, employees may decide not to have the vaccination. If an employee decides not to be vaccinated, the person must sign a form affirming this decision. However, if an employee who initially declines hepatitis B vaccination decides to accept the vaccination at a later date, the employer must make the hepatitis B vaccination available at that time, so long as the standard still covers the employee. All right, let's discuss hepatitis C. Hepatitis C is a liver disease caused by the hepatitis C virus, HCV. It is the most common chronic bloodborne infection in the United States. Its symptoms are similar to those of hepatitis B infection, including fever, fatigue, abdominal pain, loss of appetite, nausea, vomiting, dark urine, clay-colored stool, joint pain, and jaundice. There is no vaccine against hepatitis C and no treatment available to prevent infection after exposure. For these reasons, hepatitis C is more serious than hepatitis B. Hepatitis C is the leading cause of liver transplants. Okay, let's discuss hepatitis D. Hepatitis D is a serious liver disease caused by the hepatitis D virus, HDV, and relies on HBV to replicate. It is uncommon in the United States. It is transmitted through contact with infectious blood, similar to how HBV is spread. There is no vaccine for hepatitis D. Okay, so the final one, hepatitis E here. Hepatitis E is caused by the hepatitis E virus, HEV abbreviation. It is commonly transmitted via the fecal oral route and is associated with ingestion of drinking water contaminated with fecal material in countries with poor sanitation. It occurs primarily in adults. The potential for HEV transmission from contaminated food is still under investigation, and there is no evidence of transmission by percutaneous through the skin or sexual exposures. There is currently no FDA-approved vaccine for hepatitis E. Okay, so now we are going to discuss HIV/AIDS. HIV is the virus that causes AIDS. HIV attacks white blood cells and destroys the body's ability to fight infection. This weakens the body's immune system. Infections that strike people with weakened immune systems are called opportunistic infections. Some opportunistic infections that occur in patients with AIDS include severe pneumonia, tuberculosis, Kaposi's sarcoma, and other unusual cancers. People infected with HIV may not feel or appear sick. A blood test, however, can detect the HIV antibody. When an infected person has a significant drop in a certain type of white blood cells or shows signs of having certain infections or cancers, the patient may be diagnosed as having AIDS. These infections can cause fever, fatigue, diarrhea, skin rashes, night sweats, loss of appetite, swollen lymph glands, and significant weight loss. In the advanced stages, HIV/AIDS is a very serious condition. Patients with AIDS eventually develop life-threatening infections from which they can die. Currently, there is no vaccine against HIV. Tuberculosis. Other diseases are of concern. Okay, these are other diseases of concern. Tuberculosis. Tuberculosis is an infection caused by a bacterium called Mycobacterium tuberculosis. The bacteria usually attack the lungs, but they may also damage other parts of the body, such as the brain, kidneys, or spine. Tuberculosis is spread through the air when an infected person coughs, sneezes, or talks. Anyone exposed to tuberculosis should be tested. People with a weakened immune system are more likely to get tuberculosis. Symptoms of tuberculosis in the lungs may include a bad cough lasting 3 weeks or longer, a pain in the chest, weight loss, loss of appetite, coughing up blood or bloody sputum, film from inside the lungs, weakness and or fatigue, fever and chills, night sweats. Tuberculosis must be treated properly or it can lead to death. It can usually be cured with several medications over a long period of time. Patients with latent TB can take medicine to prevent development of an active TB. All right, next we're going to discuss meningitis. Meningitis is a contagious meningococcal infection that attacks the meninges, the protective coverings that surround the brain and spinal cord. Several different bacteria can cause meningitis, but a virus can also cause it. The bacteria are transmitted from person to person through droplets. Close and prolonged contact, example kissing, sneezing, or coughing on someone, and living in close quarters or dormitories can spread of disease. Meningitis can infect anyone, but is more commonly found in those who have compromised immune systems and have trouble fighting infections. The most common symptoms are stiff neck, high fever, light sensitivity, confusion, headache, nausea, sleepiness, and vomiting. Bacterial meningitis is a serious infection. Even when diagnosed early and properly treated, 5 to 10% of patients die. Typically within 24 to 48 hours of the onset of the symptoms. Bacterial meningitis may result in brain damage, hearing loss, or learning disability in 10 to 20% of patients, and sometimes death. Viral meningitis is less severe and usually resolves without specific treatment. Bacterial meningitis is potentially fatal and is a medical emergency. Admission to a hospital or health center is necessary. There are vaccines available to prevent meningitis and antibiotics with which to treat it. All right, so we have next we have methicillin resistant Staphylococcus aureus MRSA is a type of bacterium. As one of the staph bacteria. Like other kinds of bacteria, it frequently lives on the skin and in the nose without causing any health problems. It only becomes a problem when it is a source of infection. These bacteria can be spread from one person to another throughout casual contact or contaminated objects. Infections with MRSA are more difficult to treat than ordinary staph infections because they are resistant to many types of antibiotics. The medications used to treat bacterial infections. Infections can occur in wounds, burns, and sites where tubes have been inserted into the body. When MRSA occurs in groups of people who have not been recently hospitalized or have not had a medical procedure, this type of MRSA is referred to as community-associated MRSA. For example, it can occur among young people who have cuts or wounds and who are in close contact with one another, such as members of a sports team. So next, we're going to discuss influenza. Influenza. Seasonal influenza is a respiratory illness caused by both human influenza A and human influenza B viruses. which can be transmitted from person to person. Most people have some immunity to influenza, and there is no vaccine available. Seasonal influenza usually has a sudden onset with symptoms of fever, usually high, headache, extreme tiredness, dry cough, sore throat, runny or stuffy nose, and muscle aches. Abdominal symptoms such as nausea, vomiting, and diarrhea may also be present, but these symptoms occur more often in children than in adults. Influenza is transmitted from person to person via large virus-laden droplets from coughing or sneezing. These large droplets settle on the mucosal surfaces of the upper respiratory tracts of susceptible persons who are within 3 feet of infected people. Transmission can also occur through direct contact or indirect contact with respiratory secretions. For example, when touching surfaces contaminated with influenza viruses and then touching the mouth, nose, or eyes. Exposure control plan. Federal Occupational Safety and Health Administration, OSHA, regulates required employers to have an exposure control plan. The exposure control plan is a written plan outlining the protective measures the employer will take to eliminate or minimize employee exposure incidents. The exposure control plan should include exposure determination, methods of implementing other parts of the OSHA standard, and procedures for evading details of an exposure incident. The exposure control plan guidelines should be available to employees and should specifically explain what they need to do to prevent the spread of infectious diseases. So next we're going to discuss on this slide important immunizations. Okay. Before working as an EMR, you should have a physical examination to determine your baseline health status. Your immunizations should be current while practicing in healthcare and should include protection against tetanus, diphtheria, pertussis, hepatitis B, measles, mumps, rubella, also called German measles, chickenpox, varicella, and also known as varicella, influenza, meningococcal meningitis. In addition to immunizations, it is recommended that you be screened for tuberculosis and have an annual tuberculin test. Okay, on this slide, we're going to be discussing standard precautions. Standard precautions are safety measures taken to prevent occupational risk exposure to blood and OPIM, such as body fluids containing visible blood. Standard precautions combine body substance isolation, BSI, precautions and universal precautions and assume that all body fluids may be infective. We're going to discuss universal precautions. Universal precautions are OSHA's required practices of control to protect employees from exposure to blood and OPIM These precautions require that all human blood and OPIM be treated as if known to be infectious for hepatitis B, hepatitis C, HIV, or other bloodborne pathogens. Body substance isolation, BSI, precautions are a group of measures to prevent exposure to pathogens. This approach to infection control can be applied through a use of PPE, personal protective equipment, proper hand hygiene, engineering controls, work practice controls, proper equipment cleaning, and spill cleanup procedures. Here are a few applications of standard precautions. So you have personal protective equipment, proper hand hygiene, engineering controls, work practice controls, proper equipment cleaning, and spill cleanup procedures. Personal protective equipment is equipment that is appropriate for your job duties and should be available in your workplace and identified in the exposure control plan. PPE includes all specialized clothing, equipment, and supplies that keep you from directly contacting infected materials. These include, but are not limited to, CPR breathing barriers, disposable single-use latex-free gloves, gowns, masks, shields, and protective eyewear. Okay, we're going to discuss hand hygiene. Hand washing is the most effective measure to prevent the spread of infection. By washing your hands often, you physically remove disease-causing germs you may have picked up from other people, animals, or contaminated surfaces. In addition, jewelry, including rings, should not be worn where the potential for risk of exposure exists. Wash your hands frequently when practical. Wash your hands before providing care and always after providing care. Whether or not gloves are worn, local protocols may vary and should be followed. Wash your hands with soap and running water and dry your hands thoroughly. Wash your hands and other exposed skin immediately if exposed to contaminants such as blood and OPIM. Always wash your hands after using the restroom, and before and after handling food. Use alcohol-based hand sanitizers when soap and running water are not available, but wash your hands with soap and water as soon as practical. Okay. So right here, again, we discuss proper hand hygiene. We'll go over some hand washing tips. To ensure you wash your hands correctly, follow these steps. Wet hands with warm water. Apply soap to hands. Rub hands vigorously for at least 20 seconds, covering all surfaces of the hands and fingers. Use soap and warm running water. Scrub nails by rubbing them against the palms. Rinse hands with water. Dry hands thoroughly with a proper towel. Turn off the faucet using the paper towel. In addition to washing your hands frequently, keep your fingernails less than 1/4 of an inch long and avoid wearing artificial nails. At some outdoor events or workplaces, for example, on a farm or a fair, the only source of clean water may be a portable hand wash station. These stations consist of a supply of soap and potable water, and a bucket, cooler, or other container with a turn spout that allows the water to run over your hands to rinse soap away. The stations also include a catch bucket to catch the wastewater and an ample supply of paper towels. Alcohol-based hand sanitizers allow you to cleanse your hands when soap and water are not readily available and your hands are not visibly soiled. If your hands contain visible matter, you should use soap and water instead when using an alcohol-based hand sanitizer. Apply the product to the palm of one hand, rub hands together, rub the product over all surfaces of the hands and fingers while hands are dry. Wash your hands with soap and water as soon as they are available. So this is an activity that we're going to discuss in person, okay? So I'm going to give you a scenario here, and we need to meet in person to discuss this, but for now I want you to think about it, okay? So here's the activity. The foreman of a furniture manufacturing plant has called for the medical emergency team to respond to a man who has cut himself while cutting a piece of wood. When you and your partner arrive, you see that the man is bleeding from a deep cut on his forearm. Blood has pooled on the ground around him. The man does not appear to be conscious. So think about all the circumstances here. We have blood here. You have a partner. You have possible exposure. So just think about this scenario, and we will discuss this scenario in person, and we'll talk about it. Okay. So here we're going to talk about engineering and work practice controls. Okay. Engineering controls are control measures that isolate or remove a hazard from the workplace. In other words, engineering controls are objects used in the workplace to help reduce the risk of an exposure incident. Examples of engineering controls include, here on your slide, sharps disposable containers. Biohazard containers, such as those used for sharps disposal, are one type of engineering control. Self-sealing needles. Safer medical devices, such as sharps with engineered sharps injury protections or needleless systems. Use of biohazard containers and labels, and posting of signs at entrances to areas where infectious materials may be present. And here we see PPE again. Biohazard containers are marked with a biohazard symbol, typically a 3-sided design in bright fluorescent orange or orange red with lettering or symbols in a contrasting color. This symbol warns of potential infection hazards. The origin of the biohazard symbol dates back to the 1960s. It was created out of a need for a standardized, unique symbol to use as a warning symbol in response to accidental infections that occurred as a result of biomedical research. These unfortunate incidents were viewed as preventable. The symbol development was spearheaded by Charles Baldwin, an environmental health engineer at Dow Chemical Corporation. The symbol was eventually chosen best met the criteria that were tested and developed of the symbol. It is easy to recognize, has three sides so it can be identified from any angle, and can be easily stenciled for labeling purposes. The symbol was soon adopted by the National Institutes of Health, the CDC, and OSHA. So here we have vehicle and equipment cleaning and disinfecting. Vehicle and equipment cleaning and disinfecting. After providing care, the equipment and surfaces you used should always be cleaned and disinfected or properly disposed of. Handle all soiled equipment, supplies, and other materials with care. Until it is properly cleaned and disinfected. Place all used disposable or single-use items in labeled biohazard containers. Place all soiled clothing in marked plastic bags for disposal or washing. Take the following steps to clean up spills. Wear disposable latex-free gloves and other PPE when cleaning spills. Clean up spills immediately or as soon as possible after the spill occurs. If the spill is mixed with sharp objects such as broken glass and needles, do not pick these up with your hands. Use tongs, a broom, and dustpan with other similar items. Dispose of the absorbent material used to collect the spill in a labeled biohazard container. Flood the area with a fresh disinfectant solution. Use a commonly accepted disinfectant of approximately 1.5 cups of liquid chlorine bleach to 1 gallon of water. 1 part bleach per 9 quarts water, or about a 10% solution, and allow it to stand for at least 10 minutes. Other commercial disinfectant solutions are available and may have different set times. Follow local protocols and manufacturer's instructions. Use appropriate material to absorb the solution and dispose of it in a labeled biohazard container. Scrub soiled boots, leather shoes, and other leather goods such as belts with soap, a brush, and hot water. If you wear a uniform to work, wash and dry it according to the manufacturer's instructions. Clean and disinfect the vehicle according to standard procedures. Wear appropriate PPE, disposable gown, and gloves during the cleaning process and discard after use. Thoroughly clean and disinfect all surfaces that may have come in contact with the patient or materials that may have become contaminated while providing care for the patient. Use an Environmental Protection Agency, EPA, registered hospital disinfectant, and follow manufacturer's recommendations. So we're going to talk about exposure incidents next. What to do if you have an exposure. Exposure incidents involve contact with blood or OPIM. For example, a patient's blood gets into a cut on your hand. You are stuck with a needle used on a patient, or bloody saliva splashes into your mouth or eyes. You may also be exposed when in unprotected close contact with someone who has an airborne disease involving exposure to aerosolized respiratory droplets, coughing or sneezing, such as with a patient infected with influenza. What to do if you are exposed? If you are exposed, take the following steps immediately. Here you have on your slides. Clean the contaminated area thoroughly with soap and water. Wash needle stick injuries, cuts, and exposed skin with soap and water. So next we have here flush splashes of blood and OPIM to the mouth and nose with water. If the eyes are involved, irrigate with clean water, saline, or sterile irrigants for 20 minutes. Next, we have seek follow-up care as identified in your department exposure control plan. And next, we have report and document incidents. This is what you do if you are exposed. Okay, we have another scenario here in which we're going to talk about in person. Okay, we're going to discuss this of lesson 2 in person. Something to think about. You are the emergency medical responder. After EMS personnel assume the care of your patient, you note that in addition to the blood and vomit on the ground, there is some blood on your disposable gloves and the mask of your BVM, Val mask. So just think about this scenario here. We're going to discuss this in person and what your instincts would have you do if you encountered these circumstances.